Good evening, everyone. Welcome to our JoyLux Happy Hour. We're sorry to start a moment late. We had a few technical glitches, but we're glad to be here to talk with Dr. Gibson. So tonight what we've done is we've taken your questions that you've asked us and we've compiled them over the course of the last few weeks. And that's really what's driving Dr. Gibson's conversation tonight. She'll be answering those questions. If you have additional questions, feel free to put them in the chat and we'll try to get to as many as we possibly can. But I will say one of the things we get the most questions about is what is pelvic floor physical therapy? What is it? How does it work? What are the benefits? And so we're thrilled tonight to have Dr. Gibson with us, who is a pelvic floor physical therapist, a trained specialist in all of this. She got her doctorate in physical therapy from Texas Tech, and she's here tonight to answer all of our questions. As always with our JoyLux Happy Hours, we're here to learn and to learn from each other. So if you have things you need and you're wondering about, feel free to put them in. And if you miss any part of this because we were late or you have something to run to, it will be on our Facebook page. In the meantime, I would be remiss if I didn't cheers to your health and to all of the amazing women on the call and to Dr. Gibson. And with that, I will throw it your way, Dr. Gibson, to take us through some of the questions.
Great. Well, thank you. Thank you so much, Heather, and thank you for having me. I'm excited to talk to everybody today about the pelvic floor and what is it and what's pelvic floor physical therapy. Like Heather said, I'm a doctor of physical therapy and I specialize in pelvic health. And right now I am working with a company called Comet Healthcare, and we're offering online virtual physical therapy and wellness visits specifically focused in pelvic floor. So I will go ahead and get started. And like Heather said, I have a list of questions here, so I'll go through most of them. I'm going to try to get through all of them, and then hopefully leave some time as well for questions that you might have now live in the chat. So we'll get started first. So the first question is, what is the pelvic floor? So the pelvic floor is a group of muscles at the base of the pelvis. And I actually have my handy dandy model here to show you. And it is actually kind of like a sling. You can see here. So I'm going to orient you first to the bone so that you know what you're looking at. So this is the pubic bone here. Back here, right over here is the tailbone. Then we've got the sit bones on either side here. And then all the muscles here in the middle that you can see in red, those are the pelvic floor muscles. So it's a group of muscles that most of us aren't even aware exist. They don't get talked about very often, although I think that's getting better now with social media and things like that. But this group of muscles has a really important job every day. So they work to control our sphincters, and you can see that here. If I take my layer and place it back on here. So if I orient you again, we can see top to bottom here, you're going to have your clitoris here, then the urethra, the vaginal opening, and then down here, the anal sphincter. So our pelvic floor muscles help to kind of close and open those sphincters in order to help us both relax so that we can urinate or have bowel movements, and also contract when we don't want to do those things. Secondly, the muscles also provide a lot of support for our internal organs. So if we look inside the pelvis here, we can see they're a little bit cattywampus, but we can see the rectum, the uterus, and the bladder. And those all sit right on top of the pelvic floor. You can see here, you can see kind of that sling shape of muscles there. So they're very important for support as well. Another function is stability. So they are actually an integral part of our core, and they work to help provide stability for our hips, our pelvis, and even our lower back. And then they are also involved in sexual function. So the muscles do contract and relax to allow blood flow down there for us. And then they also contract and relax for orgasms and things like that. So they're a really important group of muscles that most of us don't know exist, like I said. But hopefully we can clear up some questions about them here tonight. So next on the list, one of the questions was, how does the pelvic floor change during pregnancy and postpartum? So during pregnancy specifically, our pelvic floor muscles they're undergoing a little bit more stretch, and they actually are designed to handle that stretch fairly well. But as we go through pregnancy, our hormones change, our posture changes, and some of our mechanics change as well. So over time, and especially as we get towards the end of pregnancy, there's just more demand on those pelvic floor muscles than in a non-pregnant state. And then during delivery, say for a vaginal delivery, the pelvic floor muscles do stretch as baby comes through the vaginal canal. And then even with the C-section, the abdominal muscles are involved. They do get, there's an incision through the abdominal muscles, which sometimes does end up impacting the pelvic floor as well. Postpartum, usually people are just dealing with, if there was a tear that occurred. Tearing usually happens within one of the pelvic floor muscles. And so it takes time to heal, if somebody had a vaginal delivery and tore or had an episiotomy. And so postpartum, a lot of it is just dealing with that healing process and kind of gaining strength back. So those are kind of the main changes that occur during pregnancy and postpartum to the pelvic floor. And then in perimenopause and menopause, we undergo more changes again, right? Of course, so fun, all the changes all the time. But under the influence of some of the hormonal changes that occur during perimenopause and menopause, what can happen is that the pelvic floor muscles, along with some of our other muscles, they can weaken and even thin a little bit. And again, it's due to those hormonal fluctuations. So sometimes women will experience things like leakage, kind of feelings of heaviness or weakness in that general region, and sometimes even things like painful intercourse related to those tissue changes that occur during menopause. And again, it's kind of a thinning of the muscles and then also a weakening of the muscles that can occur during that time period. And it's not, I will say this interestingly, it's really not dissimilar to postpartum. So postpartum and postmenopause, those hormonal changes kind of have similar effects on the pelvic floor. So another question was, what are the different types of incontinence? So I did mention that incontinence is something that can occur when our pelvic floor muscles are weak or not functioning well or not coordinated well. Urinary incontinence is defined as the involuntary loss of urine, and there are several different types of urinary incontinence. One of the main ones is called stress urinary incontinence. And it's a misleading term because it's not whenever we're stressed out. It's more related to exercise, coughing, sneezing, laughing, things that generally kind of increase the pressure downward on the pelvic floor. Can lead to stress urinary incontinence, where you leak when you're running, you leak when you're laughing with your friends, things like that. Another form of urinary incontinence that we sometimes deal with is called urge incontinence, urge urinary incontinence. This form of incontinence is when somebody is on their way to the bathroom, and they've got that strong sense of urge, like I got to get there now. And before they make it, they have leakage that occurs. That can happen right before they get to the toilet, or it can happen even as soon as they get that urge to go to the bathroom. So that's another really commonly seen form of urinary incontinence. And then there are a couple of other forms as well. One of them is called overflow incontinence, which is where the bladder gets over full of urine, and so it kind of passively leaks. That's not something that we see a lot in physical therapy. Sometimes that's due to other issues with the bladder and the kidneys, things like that. So if you're experiencing something like that, you would definitely want to see, a urologist to kind of take a look. They can do tests and try to figure out what's going on with overflow incontinence. And then lastly, there's functional incontinence. So functional incontinence is a form of incontinence where people may have other issues physically that limits them from getting to the bathroom in time. So say if it's really hard to get up out of bed or it's really hard to walk to the toilet, sometimes people will have incontinence because of those type of issues. So in physical therapy, like I said a little bit earlier, we do tend to treat things like stress urinary incontinence and urge urinary incontinence more often than the other types of incontinence. But the good thing is there's help out there for all of the different forms. It's just something that a lot of women believe is normal and they don't know to seek help for it because they've probably been told for years that, oh, well, as we age or because we had a baby, it's normal to have leakage. It's just something you got to deal with. Welcome to the club, when in fact there is a lot that can be done if it's something that you don't want to deal with anymore. So moving on to the next question here, are there certain types of incontinence that become more common as we age? And the answer to that is yes. So like we talked a little bit, some of the changes that occur hormonally as we age and approach menopause can lead to weakness and thinning of the tissues, which could lead to stress incontinence. And then, in addition to that, as we age, our bladder capacity also changes a little bit. So bladder capacity meaning the ability for the bladder to hold the same amount of urine and stretch the same amount, that actually reduces some as we age as well. So people sometimes will experience more urge incontinence or frequency, different things like that. So those are the two forms that I would say as we age. I see more of myself as a clinician. But that being said, I also see that in younger people as well. There was actually a recent study that came out that I can't remember the exact percentages, but there was a fairly high percentage of women who were athletes and had never had children before who had leakage. And I think that it's just, again, it's another one of those things that no one talks about it. So I would say, although, yes, it sometimes does increase in prevalence as we age, I think that more people deal with it than we realize. And it's not just related to aging or having had a baby. And then, okay, so those are our incontinence questions. Does anybody have any questions right now before we move on to a different topic? You can enter it into the chat. Let me know. Okay. Okay, no questions. So moving on. So the next question that we got was, what is vaginismus? So vaginismus is a condition in which the pelvic floor muscles involuntarily contract in response to things like tampons or speculums during pelvic exams even, and then with any kind of penetrative intercourse and penetrative sexual activities. So vaginismus, again, is that condition where all of the layers of the pelvic floor muscles surrounding this opening here are going to actually kind of spasm up, and it's involuntary. A lot of women are told, well, just drink a glass of wine and that should make it better. But the reality is, a lot of times it's not that simple. Sometimes it is, which is great, but for a lot of women, they're told that, and then they think there's nothing else that can be done, and drinking a glass of wine didn't work. So I guess this is just another one of those things I have to deal with. But there is also help for that because, again, with physical therapy, we deal with muscles, right? And so with pelvic floor physical therapy, we can also help retrain those muscles and teach the muscles how to relax and help come up with different ways of still participating in intercourse or tolerating pelvic exams or tolerating tampon use better without as much pain. So definitely some things that can be done for that condition, vaginismus, as well. And then along the same lines, the next question was, is pain with intercourse normal as I get older? So, in relation to everything we've talked about, we mentioned already the hormone changes, right? So we know that the hormone changes as we age and as we approach menopause cause that thinning of the tissue and atrophy of the muscles. And so what can happen is that can lead to sometimes pain during intercourse or with sexual activities. But again, I would say it is not something that you have to deal with. And I would not say that it's normal per se. It can absolutely happen. And again, because of all those changes that we go through, but it's not something that you have to deal with because there is help for it. So if you've been told that, or if you've been told, like I said earlier, just drink a glass of wine and that didn't work for you, physical therapy can be very, very helpful for treating those conditions like vaginismus and painful intercourses as we age by addressing the muscle tissue. Okay, and then the next question is when is the best time to start proactive care of my pelvic floor so I don't go through the same things that my mom and so many other women do? What can I do? This is a great question. So ideally, from a preventative standpoint, staying active in general can be really, really helpful for maintaining pelvic floor health. And I know that sounds really simple, but the reason is because, again, if we think back to the functions of the pelvic floor, we know that the pelvic floor is responsible for stability and providing support. So if we're active, we're walking, we're exercising, whatever that may look like for you, the pelvic floor is involved in those activities. Unfortunately, what happens a lot of times is that when women are diagnosed with urinary incontinence or even something like pelvic organ prolapse, they're either told to reduce their activity level or they just feel they need to because of the symptoms. And that can become a kind of a negative cycle where our muscles are not being used, so they weaken. And we end up not exercising because we're trying to avoid the symptoms, when in reality, staying active would really help us to keep those muscles active, keep them healthy, keep the blood flowing to the area. So that would be my number one piece of advice is as we age, especially, and even if you have been told that you have some type of pelvic floor dysfunction or issue, if you can stay active, and if you are having trouble staying active, try to see a pelvic floor physical therapist, because we can definitely help you find ways to getting back to whatever those activities that you like doing are. So that's number one. So stay active is my number one piece of advice for this question. And then second piece of advice is that as soon as you start to notice symptoms of pelvic floor issues or bladder issues or anything, sexual issues, genital issues, please see somebody for it. I know it can be really hard to talk about these things, but talk to your healthcare provider about it and get some help as soon as you start to feel off. This ties back to, being told that all these things are normal as we age, and being women is just something that we have to deal with. But I think just the power of education and knowledge is so key here, where knowing that, okay, maybe it's not so normal, or maybe it's not something that I have to put up with. Knowing that will kind of cue you in on when you need to go see a provider. So that's my second piece of advice is, if it feels off and if it feels not normal, trust your instinct, trust what you're feeling, trust what your body's telling you, and try to see a provider that can help you find the right type of care for whatever symptom that you're dealing with. Specific things to look for if your pelvic floor muscles are not really doing what they're supposed to be doing are things like bladder leakage, bowel leakage, painful intercourse, symptoms of heaviness or prolapse, and then pain. So pelvic pain, pain in the genital region, those all can be symptoms that something's going on with the pelvic floor. So as soon as you start to notice that, please let your healthcare provider know. That way you can get on the right track for treatment. So moving along here, next is I do Kegel exercises almost every day, but it doesn't seem like they're doing anything. How do I know whether I'm doing them correctly? And can I do anything else instead? So this is also a great question, and I hear this all the time where I'll work with people who have been doing Kegels for a long time and not really having any kind of improvement of their symptoms. And there's a couple of reasons why that might be. So one of the main things is that doing a Kegel properly can be challenging without some guidance. And a lot of the guidance that's out there on the internet and even in pamphlets that you might see at the doctor's office is really basic and it doesn't work for everybody. So, um, for example, if you've tried before to pretend like you're stopping your flow of urine or holding back pee, I have actually, in my experience working with people one on one and actually checking the pelvic floor strength, that cue just does not work for a lot of people. And so, knowing how to do one properly by using different cues, having somebody help you with visualizing what the muscles actually do and how they actually work can help a lot of people do the Kegel better, if that makes sense. And then the second part is that Kegels may not be working because they may not be the right type of exercise for your condition. So, for example, if somebody has pelvic pain or vaginismus or pain with intercourse, Kegels may not be the most helpful because in a lot of cases, the muscles need to learn how to actually relax. They may still need to be strengthened, but if we don't teach the muscles to relax first, they won't get as strong later. So the example that I like to use is if I use my bicep and say this, my arm stuck in this position, and my bicep is always contracting. I could do bicep curls with a weight from point A to point B, but in order to actually get stronger, I would need to be able to go all the way lengthened out and then all the way back in to actually get this muscle stronger. And it's the same principle with the pelvic floor. So a lot of times people who aren't experiencing progress or noticing changes with Kegels, it's one of those two things. They're either not doing them properly or they actually need to be doing more than just Kegels. So relaxation, coordinating the muscles, not just simply contracting and relaxing them. So that is one thing that I see a lot whenever Kegels aren't effective for somebody. And then the second part of this question was, can I do anything else instead? And it really depends on your condition, like I said, and gave some of those examples. But seeing somebody that can help you, I sound like a broken record, but seeing somebody that can help you figure out what's actually going on with your muscles is so, so key. And it's even hard to say by diagnosis what exactly you would need to do. Some people who have stress incontinence actually might have tense muscles. And so they may need to have a different kind of treatment approach than somebody who just has weak muscles. So I always recommend seeing somebody, if you can, who can help you actually figure out, okay, what condition are you dealing with and what are your muscles actually doing? And then the next question is, okay, so what is involved in pelvic floor physical therapy? Now that I've basically answered all of the questions with see a pelvic floor physical therapist. So pelvic floor physical therapy is very similar to other physical therapy in that we are still experts in muscles, bones, joints, connective tissue, ligaments, tendons, things of that nature. And we're still treating that, but we are specialized in assessing specifically the pelvic floor muscles. And so usually what seeing a pelvic floor physical therapist entails is we sit down, we have a conversation about what you're dealing with, what are your symptoms. And then from there, we decide whether, okay, does it sound like the pelvic floor muscles are involved with your symptoms or not? A lot of times there will be a screen of your back and your hips to see if there's anything going on with that part of the body. And then if there are symptoms to suggest that the pelvic floor muscles are involved with what you're dealing with, you may, the therapist may suggest that you have an internal pelvic floor muscle assessment. So this is very different from a pelvic exam in that we are not using a speculum or anything like that. We're just checking how the muscles are doing. Can you contract? Can you relax? How strong are the muscles? Those type of assessments. And that's done intravaginally with one gloved finger inserted into the vaginal canal. Now, that may freak a lot of people out. And so that's not, you don't have to have the internal exam. That is always up to the person. It's always up to the patient. There are other ways that we can assess the pelvic floor muscles externally. We can use a biofeedback machine that uses little sticky pad electrodes and plugs into a handheld device that kind of reads your muscle activity. There's always options, but that is typically what happens in pelvic floor physical therapy. From there, after the assessment, we can really make a solid plan for you as far as what do you need to do? Do you need to do Kegels? Do you need to relax? Do you need to strengthen your glutes? Do you need to strengthen your core? And so we put everything together for you and help you figure out how best to approach your symptoms. Next question is, what do you think are some of the benefits of video-based therapy for my pelvic floor? So this is also an excellent question. So with the pandemic, there has been a great increase in telehealth, utilization of telehealth services, and physical therapy a lot of times seems kind of like virtual physical therapy can seem like an oxymoron, almost like how do we even do that? And so video-based therapy for the pelvic floor is going to entail a lot of the same type of treatment minus the pelvic floor muscle assessment, obviously. So we still go through the same questions with you to try to figure out what could be going on with the pelvic floor muscles. And then beyond that, we can still come up with a great treatment plan and go through the cues and see what cues work better for you to be able to activate and release your pelvic floor. So it's very similar, minus the hands-on component. And for a lot of people, accessing a physical therapist, especially somebody specialized in pelvic health, is really hard to find in their community. And so virtual services allow for people to access specialists more easily. And so, like I said, video-based is going to be largely the same, minus the hands-on component. It doesn't work for every single pelvic floor condition and every single person, but it can really help a lot of people, especially, like I said, with cueing and figuring out what works best for you. All right. Next question is, how long does it normally take to start seeing improvements to my pelvic floor with physical therapy? This is a really common question that I get. And I'm going to sound like a broken record again, but it depends. So it depends a lot on what symptoms you're dealing with, how long they've been going on. The longer something has been going on, sometimes it takes longer to address it. Because if it's been going on for several months, it may have become more of a chronic issue at that point, and it can take more time. So it's really hard to give a specific time frame for all pelvic floor issues. But I would say that if you're not seeing some kind of improvement or some kind of change within 3 to 4 visits, then that's when we go back to the drawing board and we try to figure out, okay, what are we missing? Is physical therapy the right thing for you? Or do you need to, go back to your doctor? So it's a hard question to answer, but you should be seeing progress of some sort. Now, you may not go from 0 to 100 within 3 to 4 visits, but you should see some kind of progress within those first few visits. Next question is, are there any other things I can do at home to strengthen my pelvic floor? Yes. So like I mentioned before, stay active. Some things that I have seen people doing, outside of physical therapy that seem to really help them maintain just general core and hip strength are things like Pilates and just any exercises that you can focus on your hips and your core. Those can be really, really helpful for the pelvic floor as well. And so, just staying as active as you can, strengthening, weight bearing, things like that can be really helpful because, again, the pelvic floor muscles are really involved with stability. So when we challenge our stability, by doing things in weight bearing positions, then that can really get the pelvic floor firing as well. Um, and then we had a couple of other questions that are a little bit more specific. So I can't answer super specific questions about somebody's condition and like exactly what they should do, but I can give some broad information on these questions. So somebody did ask, how do vaginal atrophy and lichen sclerosis relate to the pelvic floor? So, like we talked earlier, vaginal atrophy is where the tissues thin and become weaker in response to some of the hormonal changes and aging that we go through. And with that, the pelvic floor muscles are part of that. They do become a little bit weaker and they can become more thin. And so that can lead to issues. With a condition like lichen sclerosis, what can happen is depending on that person's specific symptoms, if you develop pain in response to, say, something like intercourse because of the lichen sclerosis, the pelvic floor muscles can tense up in response to that pain. They're just trying to guard and protect because our body senses, pain and almost like a threat. And so they guard and they tense up. And so what can happen though over time is that if that recurs over and over again, the pelvic floor muscles can start to just learn, well, I just need to live here because I'm trying to protect everything down here. My genitalia, I'm protecting everything down here. And so it can become this cycle of pain and muscle spasm, and then muscle spasm and pain. And so that is how certain conditions like lichen sclerosis, in addition to a lot of other skin conditions and inflammatory or infectious conditions in this region, that's how the pelvic floor muscles get involved with that. So the pelvic floor isn't causing the initial symptoms or the initial problems at all, but the pelvic floor can over time start to develop that tendency to tense up in response to it. So with those types of conditions, I think it's always beneficial to have a physician who specializes in vulvar conditions and a pelvic floor physical therapist. And if you can find that team, it can be really, really helpful for those types of conditions. And the pelvic floor gets involved in that same manner with a lot of different organ related issues or tissue related issues where it's not the primary cause of the symptoms, but it becomes kind of a secondary problem. And then the last question here is, what are the best exercises for urinary incontinence? And then what are the best exercises for weak anal sphincter control? So again, it really depends. So because there's different forms of urinary incontinence and because there are so many things that can cause urinary incontinence, it's hard to say like one specific exercise that will help. A lot of people are told that Kegels will help with that. And there is a lot of research to support that Kegels do help women and men actually with urinary incontinence. But it really depends on you as an individual person. Like we talked about before, are the muscles actually weak? Are they tense? Do they need to be trained to re-coordinate? Do I need to work on my core as well? Things like that. So you'll see online and you'll read a lot about Kegels specifically for urinary incontinence. And while they are considered one of the more researched and supported forms of treatment, they aren't the only one. And without knowing what's causing the urinary incontinence, it's really, really hard to say what exercises will help. And then for a weak anal sphincter, again, it does depend, but if we know that the muscle is weak, then strengthening does help. And there are ways that people can be taught how to perform pelvic floor contractions or Kegels that are a little bit more focused on the anal sphincter versus the vaginal sphincters. And so doing some strengthening for weakness in that muscle usually helps a lot. And then I think that was my last question on the list. So overall, I really believe that pelvic floor physical therapy can help so many women. And we just don't know. We're not aware that that even exists. And um, we're not really comfortable talking about it. And so just know that you're not alone. I literally have a full-time job talking to people about these issues all day. And that's not to minimize at all what people are dealing with. It's just to show that if you feel like you're the only one dealing with it, I promise you that you're not. And there are providers out there who really care, and we talk about it all day long. And we really want to help women and other people dealing with these issues. A lot of the questions were really great, and I'm sorry I couldn't get more specific on certain conditions. But the take-home message that I wanted you guys to hear is that it really depends. Kegels are not always the answer, and it really depends on how your muscles are functioning. So seeing somebody who can help you figure that out can be really helpful. And then to wrap up, I almost forgot. So thank you, Heather, for mentioning this. I wanted to talk about my experience with the VFit. So I am a postpartum mom now. I had my baby 6 months ago, 6.5. And so I have been using the VFit, and for a couple different reasons, which I'll tell you about. But overall, my experience has been awesome. I was really kind of blown away by my response to it so far. And I actually wasn't too familiar with it before, but it's a really interesting product, and it is the mechanism by which it works is really, really fascinating to me. We won't get into the technical details because I'm not an expert in that, but a little bit of background on me is even before I had a baby, I had a pelvic surgery, and I have some scar tissue from that pelvic surgery, specifically around my urethra. And so that scar tissue has always been really hard for me to address. And what I've found with the VFit is that I think it's the only thing so far that I feel like can actually get to that scar tissue and help the tissue actually heal. So I'm really excited about that. And then from the postpartum perspective, for me specifically, what I'm using it for is scar tissue again. So from tearing, to address some scar tissue related issues there. And then also some other symptoms of just kind of feeling weakness in that region that is not actually related to my pelvic floor muscles. I think it's a tissue related issue and a hormonal related issue. And so I'm really excited to see, as I continue to use the VFit, kind of what changes, how does it change my tissue, things of that nature. And then I will also say that some of the features of the VFit are awesome. So I was actually kind of nervous about inserting it. What I found is the vibration piece of the device is so helpfar. So I have no issues with that whatsoever. And I thought that was really a really cool thing and really incredible. So far, I've had a great experience with it, and I'm excited to see, as I continue to use it, like I said, how it can address some of those tissue problems that I've had in the past. So, and if you have any questions, you can reach out to me. My email is Janelle, JANELLE, @trycomet.com. And we do offer video-based physical therapy in the state of Virginia right now. We are working on going to more states, and then we offer some wellness consultations as well throughout the United States. So I'd love to help you if you're dealing with anything, or if you have any questions related to the pelvic floor. So I will leave some resources as well with Heather to provide everybody. There's a couple of different people on YouTube that I think are great who go through some pelvic floor exercises. And so I will leave that with Heather to provide for everybody. So if anybody has any other questions as we wrap up, let me know. We'll give everybody a second. See if we have any questions. Great. Yes. Yeah, you're so welcome.
Well, thank you. I learned so much. I found myself shaking my head repeatedly with everything you said, like, "Yes, yes, that's me.
Yes.
Yes."
Oh, just
Fascinating.
it is, and it's just such an underserved area, you know.
Agreed, and we too hear it every day, Dr. Gibson, like, if someone takes one thing out of this, they are not alone.
Yes.
We are all going through this,
Yep.
and there are solutions, right? We no longer have to suffer in silence. This is no longer the badge of honor for being a woman and getting older, and, like, that is so yesterday, and there,
Yes.
thankfully, are now things that we can do, and I'm appreciative of your education and your information, and it was really so helpful. So thank you very much. I'm
Listen.
happy to share your resources.
Yes,
So
great.
we will do that with along with this. And thanks everyone for joining us tonight.
Thank you so much. It
Have
was
a great
wonderful.
night. Yeah,
You
get back to that beautiful baby.
I will, and it's just started snowing, so I'm gonna go snuggle up and lay on the couch.
I love it. Good for you. Well, cheers to you. Thanks to everyone, and we'll talk soon.
Sounds great. Thanks so much, Heather.
Good night.
Good night.